And again, parents expressing apprehension and a desire for a remote learning option. Here's what a few of you had to say. Look at this. Anxiety at an all-time high. I'm extremely worried about what will happen to the children who are not vaccinated. And what happens to parents that keep their children home? Are they going to start calling the authorities? Well, I took those concerns right to New York School's Chancellor Misha Porter, and I got the chance to speak to her one-on-one. So, Chancellor, thank you for being here on Picks and Politics. Monday obviously marks the very big day, first day back to school, everybody going to be there in person. And I want to celebrate all of that, but I also want to talk about some real concerns that people have. And first and foremost, I want to get a clear understanding of enrollment and just how many kids will actually be in a classroom on Monday.
So our schools have been really working. First of all, I'm really excited about tomorrow. It's the big day. Hurrah. We've been waiting for this for 18 months. Had to get that out. But our schools have been really working to make sure that we are getting to 3 feet of social distance in every single classroom. So it will vary from building to building based on the size of a room, the capacity of a room. It will vary from building to building. Our principals have been working very directly with our facilities folks. You know, I don't expect that we will have 34 kids in classrooms.
Okay.
But, you know, it depends on the size of a room.
Yeah, but enrollment overall for the entire school season, right? It used to be 1.1 million kids. How many are you welcoming back on Monday?
We're welcoming over 1 million students back to school on Monday.
Over 1 million, okay. And you said that you're really trying to keep with that 3 feet social distancing guideline, right? I know a lot of parents are concerned about overcrowding of those classrooms. How are you going to ensure safety? What are you capping a classroom limit at?
So again, you know, what we did was our facilities teams went to schools, looked at classrooms, and developed a capacity report for each and every room. And so, you know, it is hard to say to parents, this is what you should be looking for. What they should be looking for is ensuring that where possible, their kids are in classrooms where they are at 3 feet apart. That's what every school building has been working towards. That's what we've been planning for. That's what we've been organizing for. Right. And so, you know, again, it's really hard to say building by building. Okay. I was at a building this morning in Brooklyn. The classrooms are huge. Because they used to be shop rooms and they've been transformed into regular classrooms.
I want to talk vaccines, right? That is a big topic of conversation. I break it down into students and then staff, right? So first, for students, why not? I know you've been asked this many times. Why not mandate vaccines for those who are 12 and older to ensure everybody's safety?
I think the first thing is the Department of Health makes such a mandate, not the Department of Education, right? We mandate school. But I think we are, you know, want families to make that decision, that really important decision. We mandate it for high-risk PSAL sports. And so in places where we have a concern about the way students are engaging, we're going to work towards, you know, potentially getting to a mandate. So go ahead.
So do you know, Chancellor, do you know how many students entering the school system are vaccinated at this point?
We have 65% of students 12 to 17 that are currently vaccinated.
And for those who are under the age of 12, right, obviously that's a big concern for parents. What will then cafeteria time or gym time look like for those students?
Yeah, again, it'll vary from school to school. We'll be in masks in every building, in every classroom, in every space inside of a school building. Lunch will look like some students in cafeterias, some students in classrooms, some students in outdoor spaces. You know, again, our schools have worked to be really creative around getting to that 3 feet and making sure that, you know, we are following the health and safety protocols.
So when it comes to teachers then, right, heading into Monday, big day, what percentage of teachers are vaccinated?
We have, again, over 72% of our teachers that are vaccinated. So we're excited about that. You know, we are excited about that, and our numbers are moving in the right direction.
And you know, there has been some teachers who are concerned for medical accommodations who simply cannot get the vaccine. What are the numbers there? How many teachers are we talking that are looking at that?
We are still in impact bargaining with the union about what it means for teachers who are ineligible. So we don't have those numbers yet because we're still in conversations, but I expect that those numbers, based on what we know, would be a potential risk to be extremely low.
Okay, so heading into the school, you're not worried at all then about a teacher shortage?
No, not at all.
Oh, that is great news for parents, right, who want to have that teacher to student in-person learning option. And that brings me then to the whole topic of remote learning. Yes. So if a classroom gets shut down, what exactly happens if there's a number of COVID cases in that class, right? What happens to those students?
If a classroom shuts down, we will shift to remote. We learned a lot last year, and so we still have the ability to shift to remote if we need to, a classroom or a school building. And we're still going to work to develop our teachers' capacity to do that. We also announced, as you know, the first thing that people got upset with me about, our snow days would become remote days. So we will still be leveraging remote
Right.
as part of our collective muscle.
Okay, so to that point then, of if a classroom gets shut down, what is the number of cases in that class that it would take for a class to then go fully remote?
Well, it's not necessarily a number. It is if there's widespread, transmission in that classroom. And we still have our situation room in place that will determine what widespread transmission will
Right.
be in that classroom.
And I don't want to zero in on that, but when you say widespread transmission, you're talking about possibly more than 3.
Potentially more than 3, yes.
Okay, and then when you refer to remote learning for immunocompromised, you and I have had this conversation on the Pick 7 Morning News about having that option for immunocompromised.
Yes.
How many students and what is the definition of immunocompromised?
So we put in our health and safety guidelines a list of potential conditions that are already approved for immunocompromised families to get either home instruction
Okay.
or medically fragile instruction, which is a combination of small group, remote, and potentially a teacher coming to home if needed. Those numbers have been really low. We've gotten under 500 applications for that. But it is still open, and it is there. Those applications are reviewed on an ongoing basis.
Chancellor, I know there's a lot of excitement here, right? And I do want to ask you this question. We only have a couple of seconds left in this interview here. But there have been city council members, public advocates, and parents who have said, please have a remote option for our students. We don't feel comfortable. We might even keep our kiddos home. If you want them to fully trust the education system, why not listen to their concerns and say, okay, maybe we can do this for you at this juncture because we're in unprecedented times?
So we believe we have. We expanded our home instruction model to include medically fragile students, and we've added this layer, which is a combination of remote small group instruction to build out our capacity, to bring in how we've learned from the pandemic on how we can leverage remote instruction to how to, build out home instruction to a larger group, but a more comprehensive program. And so I really believe that that is the middle ground. I was on a conversation with parents this morning and asked them to take a look at it. Approval is not limited to the list of conditions. It's open. And I, really believe families should take a look at that. But I think this is what's important. What we all agree is the best learning happens between students and teachers in classrooms.
It certainly does. Both my parents were educators, and they believe in that truly. Chancellor, I appreciate you making the time. Big day on Monday, so good luck to you and all of the staff and those parents who are sending their kiddos back.
Okay, thanks, Dan. Have a great day.
You too. Thank you.
All right, bye-bye.
So just to clarify something about what happens if a student does contract COVID. As of now, that policy, may be very clear here, is for elementary students. If there is one COVID case, the entire classroom will go remote. For middle and high schools, that's when it changes. It all depends on the student's vaccination status. For an entire school to shut down, you heard the chancellor, there must be widespread transmission. We're going to have all the guidelines for classroom quarantines and shutdowns on our website, pix11.com.